Hi, I am Dr. Nandini Nelivigi, Director and Senior Consultant Orthodontist at Nelivigi Dental Clinic, Bangalore, Bangalore. Today we are going to talk about dental implants versus dental bridge. Now, whenever you lose a missing tooth, maybe whatever the reason is, the problem comes of replacing the missing tooth. When you visit a dentist, they can give you basically three options of replacing a missing tooth: a removable prosthetic denture, a bridge, or a dental implant. So the question comes, what do we choose? Usually a removable process, replacing a single tooth, is not a choice for many people because as an youngster you do not want to keep removing a denture to clean it up and wear it back again. So the problem now is only between choosing a dental implant versus a dental bridge. Now, what is a dental bridge? In a bridge, what we do is we cut a tooth in front of the missing tooth, cut a tooth behind the missing tooth, and involve all three to give you a bridge. Aesthetically, to look at, yes, all three teeth get replaced. You cannot make out that you are having a missing tooth. Functionally, yes, it does help you in chewing, and there is no problems with any of the chewing activities in the mouth. But the problem is, two teeth which are good, which don't have any problem, have been cut for the reason that you have to place a bridge over them. These two teeth over a period of time may develop some problem. You may require root canal treatment in these teeth and things like that. So two teeth unnecessarily have been cut to make a bridge. Probably this was the only way of replacing missing teeth years ago, but not now. What are dental implants? Now, dental implants are titanium screws which are placed in the bone, and then they get a replacing missing tooth over the dental implant. So, you do not have any problem, you do not cause any problem to the teeth in front and behind. Just the tooth which is missing has been replaced. So, looks very good. Yes, it acts also very good. Now, there one other advantage of getting an implant. One advantage, as I already told you, no other teeth are compromised. The second advantage is bone is a tissue which responds to forces or pressure falling on it. The condition of or the health of the bone remains to be good as long as forces are falling on the bone. Now, what happens in a bridge is we are cutting a tooth behind and in front and then giving a bridge over it. It does replace the crown, but there is nothing that goes into the bone. So whatever force is falling on the bridge is passed on to just those two teeth which are cut, but nothing happens to the area where the tooth is missing. So over a period of time, say a decade or so, the root or the bone in that area starts resorbing, and you can see a lot of depression happening in that area. Whereas when you get an implant done, there is an implant which goes into the bone, which is replacing the root of the tooth, and then you get a crown on the implant. So whatever force falls on the crown of that particular tooth is passed on to the bone through the implant. So the general health of the bone in that area remains to be equally good as the other teeth are. So with an implant, you are not just replacing a missing tooth, you are not causing any kind of injury to any other tooth, and you are replacing both the crown as well as the root. So the general health of the bone remains to be good. A dental implant is something which is the closest replica to a missing tooth. So whenever you have an option of a choice between a dental implant and a dental bridge, probably a dental implant would always hold a better value, except for the fact that the total cost that you may be spending for an implant may be slightly higher, not very high, slightly higher than getting a bridge done. So think wisely before you get a replacement done. Thank you so much.